So I'm a second-year student here at Rocky Vista, and I grew up in Montana, and before I came to Rocky Vista I was actually in Boston for about 8 years.
Nice.
So I have I think a nice balance between the mountain ranges of the west and then the city life of the east. So actually probably a couple of reasons. The first reason is as a kid I come from a background of medicine family-wise. So my dad's a retired surgeon and my mom is a retired nurse. So early on dinner talks were a lot of times about the most recent interesting case. And then as I grew older I came to realize that I really liked the hard sciences, biological sciences, but I also like the humanities. So the ability to kind of be that liaison, I would say, between the two, applying that knowledge to real people and helping people is what really brought me into medicine. So a lot of times I think, and I'm early on in my career, but I have had fellow peers at school when we're out just hanging out and meeting people in the community, and they'll say we're in med school, and they'll look at my female colleagues and they'll say, oh, are you in school to be a nurse? And so there's kind of some assumptions made about women's qualifications and their roles within medicine that don't really give them justice to what they're really trying to accomplish. I would really like to see continued progress towards equality is a big issue. I think as much stride has been made to really close that gap. There's still pay gap differences, especially for women, and I think providing more leadership opportunities and having women involved in leadership would be really excellent to see. So I think continued movements away from the standard, especially with residency. We always hear about residency, you work 100 plus hours a week, and I know but the field of medicine has made changes to residency work weeks, but you still hear about programs that you're working all the time. So just more awareness for resident health and promoting physician wellness, because if we're not helping ourselves, how can we help our patients? So I think the collaboration between men and women, and medicine historically has been a field dominated by Caucasian males, and sometimes I kind of feel a little bad isn't the right word, but it's challenging for me because I want to promote diversity and wellness in medicine, but then I'm a Caucasian male, so really promoting inclusiveness in medicine. And one thing I love is being able to collaborate with all my colleagues, whether they're female or minority, where they come from an advantaged background or disadvantaged background, and it's great to have people that you can work with, especially when you have patients from a background they're similar to that I can't necessarily relate to on those fundamental levels, to talk to my colleagues about and have my colleagues there that can really help that person and relate to them a little bit more than I can.